News Radio KMAN weather.
Currently 79 outside here at News Radio KMAN. Heat advisory in play for pretty much the rest of the week here. Today we'll see partly sunny skies and a high near 95. Winds as high as 30 miles an hour than tonight. Partly cloudy, 76. Thursday, mostly sunny, 95. Thursday night, partly cloudy, 76. Friday, mostly sunny and 95. Friday night brings a chance of showers and thunderstorms. Partly cloudy, 75. Then Independence Day Saturday, mostly sunny and 95. It's time for Within Reason with Mike Matson here on News Radio KMAN.
KMAN Daily Weather is presented by Fox Business Systems. How much does downtime cost you and your business? Don't let another second go by. Call Fox Business Systems at 776-1452.
Digging deeper into the conversations, trends, and ideas impacting Manhattan and the Flint Hills. This is Within Reason with Mike Matson on News Radio KMAN.
In many parts of rural Kansas, the greatest healthcare shortage is not equipment or technology, it is people. As longtime providers retire and demand continues to grow, strengthening the rural healthcare workforce has become among our state's most urgent challenges. My guests today are working to do something about it. Amy Fitzgerald is Program Director at the K-State Physician Assistant Program, and Ginger Ruhnke is an advanced practice registered nurse at the Stormont Vail Health Wamego Clinic. My name is Mike Matson. I am a one-time broadcast journalist. I describe myself as a recovering political operative and lobbyist. These days, I am a semi-retired author and opinion columnist for the Manhattan Mercury. I'm the host for this program. We call it Within Reason. It is purposefully named. It is a news media vehicle that is very specifically designed to seek, and we hope often find, what we describe as the second thought. We describe it as the gateway to critical thinking. We are live on News Radio KMAN. We are live streaming on YouTube. You can go to that website if you'd like to watch us visually. Search News Radio KMAN, and there you will find our smiling faces. And we're being recorded and will be posted as an unedited audio podcast made available on the KMAN website and wherever you get audio podcasts. Our partners on Within Reason are Stormont Vail Health, McCown Gordon Construction, and the Trust Company, Amy Fitzgerald and Ginger Ruhnke. Welcome to the show.
Good morning. Thanks for having us.
Looking forward to a conversation about rural health care. It's a huge problem.
Huge problem.
Before we get too far down the line, let's tell people who you are. Let's start with the Amy Fitzgerald 101.
101. I consider myself a Kansas native, though moved here in second grade. Grew up in Kansas. I have been a PA for approximately 34 years. It's a big number. Most of that in rural Kansas. Provide emergency room coverage for a lot of rural places, and some urban by Kansas standards, Salina and Manhattan, which federally are considered rural, but in Kansas, those are kind of urban centers. I came to K-State in 2020 to help teach PA students. I'm a K-State grad, and have now been program director for about a year.
Ginger Ruhnke 101.
I grew up in small town Kansas, just down the road, and I have a family of 4 children. My husband, we live in rural Kansas still in the St. George area. I originally got my undergraduate from Washburn University in Topeka, and then my graduate degree I got from Bradley University at Peoria, Illinois, and have worked in more of the needed healthcare fields throughout my nurse practitioner career so far. I started in the care clinic for Stormont Vail in Topeka, Kansas, which is a safety net type clinic, helping at-risk people seek primary care, and then moved to the Rossville Clinic, and then have since moved to the Wamego Clinic. So have kind of maintained that rural area of healthcare.
We often have medical guests on the show, and very often they all come with a whole bunch of letters behind their names, right? And Ginger, yours is APRN, which is Advanced
Advanced Practice Registered Nurse.
Okay.
And then I am FNP-C, which means I am a board-certified family nurse practitioner. So I see everyone from birth through end of life.
I was somewhat familiar with those. Amy, you have a million letters behind your name.
I don't have that many. Okay, so DMSC, which is Doctorate of Medical Science, and then PAC, which is PA certified, so I'm board certified.
All right. Well, so you guys are here to talk a little bit. We're going to talk about rural healthcare in Kansas, but we also want to talk about the partnership between K-State and Stormont Vail Health. And let's start by just describing the rural healthcare workforce challenge in Kansas, Amy, as you see it.
Well, and we're not unique in Kansas. We're just, it's more obvious because we are such a rural state. So there are approximately 60% of all primary care physicians in the state of Kansas are approaching retirement in the next 10 years. That's a big chunk of providers, and there's not a lot of younger providers, physicians, trying to move to rural Kansas. So.
When you see that in the clinics in the rural community, especially in Wamego, Ginger, give us a sense of do you actually how does it manifest itself? Do you find that people are working longer hours? Just give us a feel for what the real world practical realities are.
Yeah. So, hour-wise, yes, you see people picking up extra shifts to cover some of those shortages. As well as just not a lot of drive to be a rural provider because of the fact a lot of times there's longer travel distance. And I know in Wamego we're kind of, out there, and we have easy access to Manhattan and pretty easy access to Topeka, but it is still a rural community, and those challenges manifest themselves in not a lot of people wanting to come into that specialty in medical care.
Well, and that's a trend line that's been going the wrong way for some time, Amy?
Yes. Yes, and suspect it'll continue to worsen. We have a lot of small rural hospitals that are closing. There's not the money rurally to keep them supported, and there's difficulty in staffing them, not just providers, but nurses, maintenance, dietary. There's a lot of people that have to staff a hospital, and those people aren't available in the shrinking communities.
We are visiting today with Amy Fitzgerald. She's the program director of the K-State Physician Assistance Program, and with Ginger Ruhnke. She's an advanced practiced registered nurse at the Stormont Vail Health Wamego Clinic. Your two systems, Kansas State University and Stormont Vail Health, are not just sitting back idly by and waiting for this crisis to get worse. You're taking some proactive measures. You've got this Physician's Assistant Program. You'd mentioned, Amy, 2020. Take us back to the beginning and what it looked like and how
So
it's
I wasn't
evolved.
there in the very beginning, but this was a vision that was by the dean of our college at that time. He felt that this was a missed opportunity to fill some need in the rural community. So they began an investigation with KBOR,
Kansas Board of Regents.
Board of Regents, sorry.
The governing system for state public universities.
Yeah, so deciding where we should have another program. At that time, the only PA program in the state was in Wichita. They're long-standing. They began in the 70s. They're one of the original PA programs. But there was more need than there were PA students graduating in the state of Kansas. So it started up, we talked to all the universities. KU wanted to stick to nursing and MD. So eventually K-State became the obvious choice, and then we developed that program.
So physician's assistant, right? They're most of our listeners are like me. They're going to be a mile wide and an inch deep. And you'd mentioned, Amy, all the workforce, all the bodies that are involved in healthcare, right? There are many of them are support, their infrastructure, their IT, but you've got a whole other realm of individuals that are involved in healthcare work. Ginger, give us a sense of what a physician's assistant is and does.
Yeah. So in many ways, we are still that provider for the patient. Within my clinic, we still have physicians in the clinics that we can collaborate with. We provide all those primary care services for those patients, whether it is preventative services, it is treating current acute illnesses, it is navigating chronic comorbidities. We prescribe. We diagnose, we do testing and order testing, we make referrals when needed. We function in that capacity to provide a full range of health care to a patient.
And again, to help describe the job, give us a sense of the training and education that's needed for a physician's assistant, perhaps as compared to a registered nurse or a full-blown MD.
Yeah. So obviously, medical school is going to be quite a few more years, but that's not we also put in a lot of time and effort. So as a nurse practitioner, I did my undergrad, So that was 4.5 years of school for my bachelor's in science of nursing. I then went into the workforce for a couple of years and then went back to grad school, and that was another 3.5 years of grad school learning the more intricacies of being a provider versus being a nurse.
And that's somewhat typical of PAs, what you're describing?
It's a little bit different pathway for PAs as opposed to nurse practitioners.
Is it? Okay.
We kind of end up in the same place, but different backgrounds.
The partnership between Kansas State University and Stormont Vail Health is helping to address one of our state's most pressing challenges, preparing enough highly trained healthcare professionals to serve all of our communities. We're just getting started with Amy Fitzgerald and Ginger Ruhnke. Stay with us.
This is Within Reason with Mike Matson on News Radio KMAN.
Stormont Vail Health is your go-to for exceptional care right in your own neighborhood.
The Flint Hills campus in Junction City is open 24/7 with a full-service hospital and rural health clinic. You'll find primary care and advanced lab services at our Wamego clinic to keep your family healthy without the drive. Our Manhattan campus offers a wide range of primary and specialty providers, plus imaging and lab services, and a pick-me-up at Radina's inside our campus. Visit stormontvale.org.
Stormont Vail Health. High-quality care closer to home.
Presented by Chick-fil-A and Community First National Bank. America 250. Happy birthday, America, where freedom is written, protected, and lived every day.
56 delegates signed the Declaration of Independence. Merchants, farmers, lawyers, leaders. They knew the consequences by signing they were committing treason against the British Crown, punishable by death. Yet, they signed anyway, pleading their lives, their fortunes, and their sacred honor. These were not just political figures, but individuals willing to risk everything for the cause of liberty. Their courage helped turn an idea into a movement, and a movement into a nation. America 250, built on bravery, sacrifice, and unwavering conviction.
Brought to you by Chick-fil-A, Community First National Bank, Faith Furniture, Rothwell Landscape, Visit Manhattan, the Museum of Art and Light, and Manhattan Broadcasting.
Military service can leave a lasting impact, and support should never be out of reach. Pawnee Mental Health's Prior Service Program provides behavioral health services for former service members and their families, regardless of branch, length of service, or discharge status. No DD-214 required. From therapy and psychiatric care to case management, VA navigation, vocational support, and more, we're here to meet you where you are. Learn more today by calling Pawnee Mental Health at 785-587-4300 or visit Pawnee.org. Pawnee Mental Health, supporting those who served and the families who stand beside them.
K-State Credit Union, Conza United Way, and Manhattan Broadcasting are teaming up for the 19th annual Stuff the Bus. Help ensure that every USD 383 student starts the year with all their needed school supplies. It's as easy as coming to Walmart in Manhattan on July 18th between 10 and 2 p.m. to help us stuff the bus with school supplies. Find a list of needed supplies at stuffthebusmhk.com. Items can also be dropped off at the 2 K-State Credit Union MHK branches. Help us stuff the bus July 18th, brought to you by K-State Credit Union, Conza United Way, and Manhattan Broadcasting.
This is Within Reason with Mike Matson on News Radio KMAN.
We're back with Ginger Ruhnke, an advanced practice registered nurse with the Stormont Vail Health Wamego Clinic, and with Amy Fitzgerald. She heads up K-State's Physician Assistant Program, a unique sort of effort involving the two systems. Amy, we were talking about nomenclature, which is so important in your world.
Yep.
It is not physician's assistant.
Correct.
It is physician assistant. Help us understand that.
So the idea is that we're not possessed by the physician. So we are
possessive grammar.
Yeah. Yes. So
Okay.
we're an independent. We're individual. We practice as part of a team. The current move is to change our name to physician associate. Some confusion around physician assistant. People think we're just starting out our education or
Just
we're
taking notes.
Yeah, exactly. So there's a move, and it's a gradual process because the term physician assistant is so ingrained to move to physician associate, and we'll see that more locally over the next few years.
And my guess would be, just given my experience with massive systems, it is something that will start in academia. It'll work its way through big healthcare systems like Stormont, Vail Health, and at some point somebody's going to flip a switch and say we're changing it, and everybody else will follow suit.
Yes, and that changing that word is a big task, especially if you look at something like a university where changing words needs approval. So and how many places we use that term.
It is like steering a battleship.
It is.
Right, you'll turn the wheel 5 degrees, and then 6 months later you might see a change.
I see a little turn.
Fair enough. Help us understand, Amy, the origin of physician assistants / physician associates. Is it a relatively new concept in the long arc of medical healthcare?
In the long arc of medicine, it is fairly new. In our lifetimes, it has been around for more than my lifetime. It did start in the 1960s. It is an offspring of the military corpsmen who had vast training in war times, specifically the Korean War and maybe early Vietnam War. And there was a physician shortage at the time. So Duke University created the concept and taught the first class of 4 corpsmen to become PAs.
We are visiting today with Amy Fitzgerald. She's the program director of the K-State Physician Assistant, soon to become Physician Associate program, and with Ginger Ruhnke. She's an advanced practice registered nurse at the Stormont Vail Health Wamego Clinic. And Ginger, earlier you had sort of described your rural sort of experience. Yep. When you think about rural healthcare shortage, when people hear those words, what do they most often understand about what it actually looks like on the ground?
I think that one of the biggest issues is when they hear rural healthcare shortage, they think lack of ability to provide that care. And it really isn't. It really is not. At our clinic, we strive to provide services to all of our surrounding communities. And just because we are a smaller clinic or we are in a rural area does not mean that we don't have the capabilities of providing all of the services that patient needs via referral to other specialties. With the lack of providers that are in just rural healthcare in general in the United States, we strive to show that we need more providers in that area. And with working with the PA program, I do precept some of those students. And
precept is another word. It means what?
So they are with me to kind of learn the ropes would be a good way to put it. Yeah. And see what it's like to be a provider, to get, the kind of their feet wet on that and learning and gaining that experience of seeing patients face to face and working through their plan of care and caring for that patient as the provider for that patient.
Ginger Ruhnke is an advanced practice registered nurse at the Wamego Clinic, Stormont Vail Health, and Amy Fitzgerald heads up the K-State Physician Assistant / Physician Associate program. Amy, take us inside the program and help us understand how the students actually get out into the field.
So our program is 27 months long, so it's 2 years plus a semester. The first 12 months are in the classroom. They are 8 to 5, Monday through Friday in the classroom, very intense medical knowledge. After that, they go into our clinical phase, which is a year plus a semester, where they go out to different clinical sites for about 4 to 5 weeks at each site. So they could be primary care, like Ginger. They could be cardiology. They could be orthopedics. They could be an emergency room. It just broad, to give them a broad clinical experience.
Is the clinical experience part of what they need to do before they can actually get done and get certified?
Yes, absolutely. They need we can teach them a lot in the classroom. That doesn't teach them how to interact with patients in a real environment.
Yeah,
go ahead.
Yeah, give us a sense, Ginger, when they come to you in Wamego, and you get half dozen at a time, 1 or 2 at a time. What's it look like?
I get 1 student at a time.
Okay.
And that's very helpful because then I can focus on that 1 student. And I strive to give them the best precepting experience possible. I want them immersed in what it is that I do. I want to share my passion with rural healthcare with that student. Once they graduate, these people will be my peers. And so anything I can do to help further that with them and further them along in their education and their career to make them successful providers in the future, to help expand healthcare accessibility, is my goal.
Ginger Ruhnke is an advanced practice registered nurse at the Stormont Vail Health Wamego Clinic. Amy Fitzgerald manages the K-State Physician Assistant, Physician Associate program. The nomenclature is changing. Part of our job on this show is to help promulgate that change, and so we'll use both concerns. So is it their first clinical experience when they come to you, Ginger?
So not necessarily. So sometimes I do get students that it is their first clinical out of the gate after their year of in the classroom, and other times I'm getting them further along in their clinical experience. It all just kind of depends on what necessarily they're coming to me for. So again, I do family practice, and so sometimes it's for generalized primary care, and other times it may be for further along in their clinical experience, needing clinical hours for like geriatric medicine, things like that.
Potential specialties along that line?
In terms of
like geriatric medicine and that sort of thing?
So, yes.
So geriatrics is synonymous to family medicine in Kansas.
That's
Correct.
a fair point, right? Just look at the demographics.
Demographics.
Right? Correct.
So we do a lot of geriatrics, but we like to emphasize geriatrics too, because it is an important part of rural medicine.
And when to hear you guys say that, right? That is those are big systems that have adapted themselves to the reality on the ground, right? And so you see what you have out there just in terms of the patient clientele, and you're adapting your systems accordingly. Give us a sense, Amy, if you can, and it's going to be hard to generalize, but the individuals who make a decision to enroll in the physician assistant program at K-State, who are they? What do they look like?
Oh, it is such it's a broad background. All of them have some touch of medical experience. They range from athletic trainers, chiropractors, nurses, scribes, all sorts of background, and they come into the program from all over the country. We need to map out all our states, but quite a few. We try to encourage people from Kansas because they understand already, and they're more likely to stay in Kansas if they've been here. So we have 44 students each calendar year. Each cohort is 44 students. So it's very selective. We're in the process now, and there's over 800 applicants for this next class.
What motivates them to head down this path?
Most of them really want that hands-on caring. There's the dilemma of going on to MD or PA, and a lot of people just want to get out there. The PA program is slightly over 2 years, as opposed to medical school and residency.
Yeah, because that's 4 years and then another 3 of residency or whatever, and then there could be fellowships or whatever, and
Exactly.
2 decades later, you're actually
exactly.
you're actually getting a job. Give us a sense, Ginger, of your own personal story. Right? You're an advanced practice registered nurse. At some point in your life, you said, "I'm going to do healthcare." Right? Take us back to that day. What went through your head and your heart?
So, I actually originally had gone to college to be a vet. And
we have one of those here at K-State.
right. That I actually had started there, and along the way, I had my daughter, and the experience that I had interacting with the medical staff and the nurses that took care of me, the providers that took care of me, just kind of changed my way of thinking of human medicine. And at that time, I was like, I might want to do that someday. And so I had actually ended up getting my CNA license then and working in a local nursing home where I was living and taking care of patients, and decided, this is what I want to do. And went through nursing school, and I got through nursing school, and it had always kind of itched at the back of my brain that maybe I wanted to do something a little more with my nursing career. And so then one day I just decided, hey, I'm going to go for it. And applied, and the rest is history.
Fair enough. Ginger Ruhnke is an advanced practice registered nurse at the Stormont Vail Health Wamego Clinic. And Amy Fitzgerald is the program director of the K-State Physician Assistant program. We've had a lot of folks on from your industry, right? And this is my interpretation, and I would like you guys' interpretation of this, is that there seems to be a thread within anyone involved in healthcare in some form or fashion that you think about others first, right? Has that been you guys' experience?
Yes.
Yes, and can that be taught, or is that an innate sort of cultural, sort of Kansas-driven thing?
Didn't know we were going into deep philosophical questions.
We try to do it all here
I think looking at our students that we've had through our program, I think most of them have that desire to help people at their core. I don't think it's anything we've had to teach them. Some of them need refinement. Maybe they're
social skills,
especially the younger ones, is somewhat lacking, probably because they're still the COVID kids.
Yeah.
They missed out on some of those social skills. And then current technology drives people to be less connected. So there are skills we have to teach them, but I think innately they all want to help.
Well, and Ginger, there's something in your industry called bedside manner,
Absolutely.
right? That's something that's really important in terms of your ability to succeed.
Absolutely, it is. Being able to go into a room, whether as a nurse or a nurse practitioner, being able to go into that room and sit down and actually connect with that patient and make that patient feel comfortable to talk about what is going on, to be able to talk about, what concerns they may have. There are a lot of things that people don't want to open up about, and that's something that, good bedside manner, being able to connect with people, that caring heart can help with.
Well, and that's a learned skill, right? You have to be good at listening. You have to read between the lines, right? You have to read body language. You have to get a sense of all of that. And my guess would be, my experience tells me that will come with experience, right? People graduating from PA school might not have it right away, but you hope they have it in a year or two.
Yeah. I think that, I think it's something that, people naturally have that go into these fields, but I do think that it kind of gets honed in over time and developed, and they are able to better utilize that with patients versus just, being very machine-like when they go in and
walk in and say, "What's wrong with you?"
Correct.
Right, you don't want that, right? Stormont Vail Health serves as a key clinical partner to the K-State Physician Assistant program. They provide students with opportunities to learn alongside experienced healthcare in real time in real places in Kansas. More still to come with Ginger Ruhnke and Amy Fitzgerald. Stay with us.
This is Within Reason with Mike Matson on News Radio KMAN.
At Stormont Vail Health, our patients are our neighbors and our communities are home.
We invest in your health and our community by bringing high-quality healthcare closer to home. From our Wamego Clinic to our new campus in Manhattan and the Flint Hills Hospital in Junction City. Our partnerships with organizations like the Mayo Clinic and the Children's Miracle Network bring top-notch expertise to our region. We take pride in local collaboration to stay connected to our communities. Visit StormontVail.org.
Stormont Vail Health, high-quality care closer to home.
Point. Hey, you okay? You don't normally miss those shots.
I just haven't been as regular lately, and it's making me feel sluggish.
You should try Metamucil. It's been a game changer for me. Metamucil's plant-based psyllium fiber helps trap and remove the waste that weighs you down. Ace, you're moving better than you were last week.
Definitely.
Metamucil keeps you moving. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. Learn more at metamucil.com.
And the match is about to begin.
Most of the team is out with COVID-19, so there'll be some substitutes tonight.
What's this? We have an unexpected guest on the field.
It's a dog. Well, they could do with extra players.
She's going for the ball.
Are front paws hands or feet?
Soccer season is full of surprises, and COVID-19 could be one of them. If you test positive, prescription medications may help. Ask your doctor if they're right for you. Learn more at PfizerForAll.com. Sponsored by Pfizer.
The Crisis Center invites you to a breakfast fundraiser and silent auction Saturday, July 11th from 8 to 1 at College Avenue United Methodist Church. Enjoy biscuits and gravy served by the Lions Club and support victims and survivors of domestic violence and sexual assault. Bid on unique items and experiences. Tickets are $10 for adults, $7 for kids 10 and under. Learn more at thecrisiscenterinc.org or call 785-539-7935.
First impressions matter. Your home makes a statement about you. It's where you recharge and make your lasting memories. Tallgrass Windows and Doors knows that you want windows that reflect your style and leave a lasting impression. Do you want an entrance designed with Tallgrass Windows and Doors that says, "Welcome home. We've been expecting you"? Check out their showroom floor in Wamego or Lawrence and visit their website at tallgrasswindows.com to start exploring your options to your dream home. Tallgrass Windows. Excellence without exception.
The Ramsey Show, today at 10. This is Within Reason with Mike Matson on News Radio KMAN.
We have returned with Amy Fitzgerald, who heads up the Kansas State University Physician Singular. Thank you, Amy. Physician Assistant efforts, soon to be known as the Physician Associate, because they are not note takers. They are actual practitioners of healthcare. And with Ginger Ruhnke, who is an advanced practice registered nurse at the Stormont Vail Health Wamego Clinic. And we are talking about physician assistant. We're talking about rural healthcare, what it looks like in Kansas today. Amy, let me start with you. What types of patients and medical conditions in rural Kansas are probably most common these days?
Of course, our populations tend to be more geriatric, but anything is possible to be seen in rural medicine. The numbers are just smaller. So what are your chances in western Kansas, this may not be a good analogy, of seeing a gunshot wound? Actually, it's pretty significant, but it's not going to happen every day, but it could happen anytime. So we need to train our students to have a broad understanding of anything that could present in rural Kansas.
Is that changing the role of providers in terms of those sorts of things?
I think there's been a kind of a roller coaster of what the rural providers do. They used to be very integrated in the community. They were involved in every activity. Then there was kind of a step back of this is requiring too much. When I started, we were still doing house calls, and that kind of fell out of favor. And I think we're starting to see some of that come back. I think we're seeing a lot more of the young providers wanting to have that community involvement in day-to-day.
When you have the students, Ginger, that come from the K-State PA program and they come to the Wamego Clinic where you're working and you're building a relationship with them and they're getting that training in real time and they're learning what it means to be a healthcare practitioner, do you encourage them to try to think about rural Kansas for keeps?
Yeah, I do. And it's actually a conversation that we have multiple times about rural medicine and staying, within the small communities, if that's something that they're even thinking about, and encouraging them even into primary care. And it's quite amazing how many of them, though, after clinical, really actually have an appreciation for rural medicine and what we do in smaller communities to provide health care for the people we serve.
When you think about I said it again. I'm working, just so you know, I'm working desperately to cancel these words. When you think about it, I use it's a crutch. I use them way too often. Amy, when you consider the long pull of history, and when you consider the demographics of Kansas and where we are now, it's no secret. You guys have touched on it a couple of times. We've got a lot of older folks, right? We have baby boomers who are retiring, and they're moving on to their great reward. The numbers won't be there at the same quantity to replace them. How does that impact systems like K-State and the Physician Associate Program in terms of
So ironically, we're seeing a lot of young people wanting to return to rural communities. There's a big movement to get back to their roots, go back, establish a simpler life. So we're actually seeing sort of two populations in rural. The geriatric, who have been there their entire life and will live and die there. And then we're seeing this influx of young families who bring a whole new set of problems with young kids and more middle-aged type things. So we have to teach our students very broadly.
It doesn't take long, right? When those sorts of things start to occur, it doesn't take long for that to become sort of a community conversation in smaller towns like Wamego, right?
Yeah.
You deal with daycare, right? You deal with all manner of things. Is that what you find with some of your providers, Ginger?
Yeah, absolutely. And those are factors that people look at too about moving into rural communities are, what different amenities are accessible for them when they are there, especially when we're talking about younger families and, with kids and things like that, are things like daycare, transportation. Even with the aging population, transportation in rural communities is a very big point of conversation. So I think that those things have to be looked at, and hopefully more of those services are provided to help encourage people to move into those rural communities.
Well, and if nothing else, the demand will create a community conversation.
Yeah. Right. And we're seeing this, which puts K-State in a great position, being a land-grant university. To keep a local hospital or medical clinic viable, you have to have those other sources. You don't have to, but it's best to have a grocery store locally. It's best to have a local school and not send the kids on a bus for 30 minutes. So you need those other things in the community to keep the clinic alive, daycare being a big one.
We are visiting today with Amy Fitzgerald. She is the program director of the K-State Physician Assistant / Physician Associate Program, and with Ginger Ruhnke. She is an advanced practice registered nurse at the Stormont Vail Health Wamego Clinic, and our topic today is rural health care in Kansas and the very specific program that Amy's involved with and what the PAs do when they go to the clinic in Wamego and other communities. COVID changed a lot of things. Right, and the pandemic changed a lot of things. We became reliant, probably over-reliant on technology. Public school people will tell you it was a disaster, right? Healthcare, it was. Oh my gosh, we're just gonna go from in-person visits to the doctors to telehealth. Has it worked? Is it getting better? I mean, give us a sense.
So I think it's a benefit of COVID is that telehealth developed. We were on that pathway, but this accelerated it, which is great for rural Kansas. If you need to see a cardiologist in Southwest Kansas, you got to travel. So can you do that routine follow-up via telemed, which also has allowed us to develop medical hands-on tools that people can use in their home to assist with telemed. We helped K-State Engineering work on a stethoscope that somebody at their house could apply to their chest, and it could be heard by the cardiologist on the telemed. So they were actually hearing the heart sounds. So
if you think about the way that technology has sort of influenced your industry, and we've had some guests on from the Stormont Vail Health System who have described it, and they talk about just how the patient now has so much more involvement in his or her health care than perhaps. Is that, Ginger, is that generational? Is it someone my age who has grown up, or my parents' age who has grown up to listen and respect everything the doctor says and then go do that? Has that evolved a little bit?
I do think it has. The ability to access, like within the Stormont Vail system, we use MyChart, and the ability for these patients to do telemed visits, to be able to see their notes on their chart, to be able to see all of their medications, order their refills, I think has really helped to, in all generations, evolve people's stake in their own healthcare. It has helped them to be more involved in their healthcare and ask more questions and be able to figure more things out.
The Physician Assistant, Physician Associate program at Kansas State University, sort of designed from the ground up, as you had described earlier, Amy. It's sort of a feather in the cap of K-State, right? People don't think of K-State as a med school.
Correct.
Right, but you still have this program, right? And it is the only one in the state, apart from WSU.
There are new programs again. There's one at Ottawa University in Overland Park. Technically UMKC, even though they're part of the Missouri system, but they're in Kansas City. And then Southwestern is in Winfield, and they will be starting this year.
And so those are relatively new off the ground?
They're newer than we are.
That tells me there's a demand.
There is absolutely a demand.
Right, and so when you are an academic system, Kansas State University, and you visit with industry stakeholders like Ginger and others, right, and help us understand what that looks like, just in terms of how those conversations start, and then what actually has to happen to start a program.
So there's a lengthy process to get accredited.
You don't just flip a switch.
You do not just flip a switch. It is a big switch. There is an accrediting body that has very strict guidelines. They want to make sure that all programs are graduating PA students, graduating PAs that are going to meet all the demands. So it's probably about a 2-year process before you first have students.
Well, and then you have to staff it up, right?
Yep.
And so help us understand, give us a sense of what it looks like, the program looks like at K-State. How many people are involved with it in terms of teaching and that sort of thing?
Sure. So faculty, I have both full-time faculty for our program, and then we have instructional faculty that teach other places at K-State, and we share them. So full-time faculty I wish I would have counted, but I think I have 7. They are PAs, and I have 2 MDs that do our core instruction. And then we are lucky because of the vet school. We have a professor from veterinary college that teaches our anatomy and physiology, which they're taught comparative anatomy. They're taught all body systems. So it was a natural fit for them to come over and teach our human anatomy. And then we have some kinesiology professors that help us with pathophysiology.
These are hard words, right? I'm not writing them down, but this is why we have you on here to help understand all of that stuff. Great physician assistants aren't really built by textbooks alone. Kansas State University and Stormont Vail Health are proving that the best classroom sometimes wears a stethoscope. We will land the plane with Amy Fitzgerald and Ginger Ruhnke after we pay some bills, so stay with us. The Trust Company is an independent, locally owned wealth management and investment company founded right here in Manhattan in 1992. The experienced professionals at the Trust Company are recruited specifically for their financial, legal, accounting, and business expertise. But they're also your neighbors, and they will be guided by your hopes and dreams and will come to deeply understand your aspirations and goals. The Trust Company, locally owned, client-focused. Their only allegiance is to you. Visit thetrustco.com.
We're bringing the studio to your screen. Within Reason live on YouTube each day. Subscribe now and join the conversation.
Manhattan Broadcasting is keeping it local. Dollars spent locally today help build a better community for tomorrow.
From simple things like hail damage to complete restoration, Quality Collision will keep your car looking as good as the day you bought it. And they work with all major insurance companies. Quality Collision, where quality is more than their name, it's a promise to their customers.
WTC Fiber Internet is on its way to all of Manhattan. Sign your home or business up today at WTCKS.com. No contracts, no data caps, or overage fees. Fast, local, reliable. WTC Fiber Internet. Sign up today at WTCKS.com.
Summertime means fun time at Baskin-Robbins in downtown Manhattan. Check out our great summer flavors like football fireworks, beach day, and America's birthday cake. Located in downtown Manhattan, you're never too far away from your favorite scoops, shakes, and cakes. Baskin-Robbins, a Streeter family business. Our family serving yours.
Manhattan Broadcasting is keeping it local. Find more great local businesses plus special deals and offers when you keep it local on our website.
Attention Kansas voters, this is an important reminder from the Office of the Kansas Secretary of State. Beginning this year, Kansas elections will not include a 3-day grace period. All ballots must be received by the close of polls on Election Day to be counted. If you plan to vote by mail, return your completed ballot as soon as possible. You may also return your ballot in person to your county election office. Please visit votekansas.gov to access your mail ballot application.
Sponsored by the Office of the Kansas Secretary of State and aired in cooperation with this station.
Stop. Look no further than Buck Roofing. For nearly 20 years, Buck has specialized in top quality roofing, installation, and repairs for residential and commercial properties. Call for a free, no obligation estimate. 785-230-9379.
KMAN's Morning News. Tomorrow morning, 6 to 9. This is Within Reason with Mike Matson on News Radio, KMAN.
We have returned. The topic today is rural health care and the workforce needed to provide it. Amy Fitzgerald leads the Physician Assistant program at Kansas State University. Ginger Ruhnke is on the receiving end as an advanced practice registered nurse in the Stormont Vail Health Wamego Clinic. Right, Amy spent the last 48 minutes or so with Ginger describing the program. Right, it's academic. You're teaching people to go into the real world. So there are some awards associated with that, which is one of the reasons that Ginger's here. So tell us how she's being feted.
Okay. So we are privileged to have Dean Kokenauer as a donor to our program. They give us money to help support rural health. They support our students when they're in rural Kansas rotations. A small part of that is also to support those preceptors in rural Kansas that take our students.
And preceptors are the clinics?
Yeah, they're the clinics. They're the medical providers that train our students in clinical sites.
And it's called the Dean Kokenauer Award. Who is Dean Kokenauer?
So he was a Kansas businessman, came from a very humble beginning. He had a gentleman that stepped forward and said, this guy needs to go to college, and put him through McPherson College. And he was forever grateful for that hand up. And so the family has decided that to use his trust in his honor, they would like to give a hand up to others.
And you get the award, Ginger.
Yes.
That's got to feel good.
It does. I'm surprised and also very appreciative of being able to receive this award. I precept students not for any notoriety, but for the fact that I like to do it. I like being that part of students' education and growing in their careers and learning to love the medical field. And this is just now something we can use to help provide more services to our patients.
Well, it's a feather in the cap, not only of you personally and professionally, but of the Stormont Vail Health System, right? K-State gets the opportunity to work with what you guys describe as preceptors. I've learned a new word today, right? And so, what is it? A trophy? Is it an engraved certificate suitable for framing?
It is money.
It's money. Okay.
It is money. So we selected our top 5 preceptors based on how many of our students they took in the last year. And so those top 5, we said, thank you for supporting our students and helping them get rural Kansas experiences. And so they get a dollar amount to them.
Ginger, you should hold out for a trophy, too.
Yeah. Okay, we might have to take some money out of your award for the trophy.
Maybe a ball cap, something, right? A T-shirt at the very least.
A pen. We'll give you a pen.
Yeah. Ginger Ruhnke is an advanced practice registered nurse at the Stormont Vail Health Wamego Clinic. Amy Fitzgerald is program director at the K-State Physician Assistant program. And we've spent the last 50 minutes and 39 seconds talking about rural health care and what it means. And we've dived into the just sort of the challenges that are being faced in Kansas. When you think, Ginger, of the work that you do, right, and the physician associates that come from K-State, and you play this forward a dozen years, right, when the demographics of Kansas will have changed a little bit, what do you think it's going to look like?
My hope is that we see a healthier Kansas in general, that people continue to have a bigger say in their health care, that we are inspiring more providers to be involved in rural medicine to improve access and those services to the rural community, just to, again, help improve the health of Kansas in general.
There are so many more systems involved in that work today, apart from the medical industry, right? I think of all of the philanthropies that are involved, the Kansas Health Foundation. I happen to serve on the Sunflower Foundation board. We serve as a catalyst to help others. And so there are other systems that are involved in the conversation in Kansas that haven't been over generations. That has to be a benefit as well, Amy?
Oh, yes. I mean, the amount of information and help for rural communities through the concept of medicine isn't the only answer to health issues, that food, nutrition, exercise, those are big, important concepts in the state and at Kansas State University.
You are knee-deep, neck-deep in the challenges associated with working in an academic system, a land-grant system, right? You work through all the hoops, you gain the experience to understand how to steer the battleship, to get something different. If you were to wave a magic wand, what's the one thing in the system you would change to make things better?
Academically?
Yeah.
We're going to need to be able to adjust more quickly. Technology is approaching us really fast. The university is somewhat of, especially a state university, is lots of systems set up that they need to be able to adjust to different learning styles and different technology as it becomes available.
How about on the practical end, Ginger? If you had a magic wand, right, and you could wave it, and you could change one thing about the way that rural health care is dealt with in Kansas, what would it be?
You thought I got the tough question.
Yeah, you guys, there's quite a few things. I think the biggest thing would be accessibility to everyone, and helping provide those amenities that are needed for people to be able to access rural health care. And if I could throw a second one on there,
sure.
Making sure that systems are in place to make healthcare affordable, because I think that is also a big barrier within the United States for healthcare.
And it doesn't take long. You nailed it, right? It doesn't take long for healthcare to bump right up against public policy ideas, conversations that are underway. They're not new in Kansas. They're not new at the national level. It doesn't take long in these conversations to recognize how complex it is, right? And so it's important, I think, for consumers of healthcare to be involved in their own healthcare decisions. Has that changed a little bit from your perspective, Ginger? Is it generational just in terms of the way people approach their own healthcare?
I do feel that it is generational, that we're seeing people be a lot more involved in their health care, especially in younger generations. But at the same time, we do see even older generations still taking a bigger role in their health care to maintain their health and their quality of life.
Ginger Ruhnke is an advanced practice registered nurse at the Stormont Vail Health Wamego Clinic. She is joined today by Amy Fitzgerald, who is Program Director of the K-State Physician Assistant Program. Amy, if you could spend 5 minutes with a high school student in rural Kansas, what would you tell them about the opportunity that you provide at K-State through the PA program?
One of the problems with the PA program is we're so far removed from that student. Because our students already have an undergraduate degree before they come to us. So they've had 6 years away between high school and us. But I think we're going to see them want to stay connected with those rural communities. And I think the important thing is to give them a clear pathway that they can do that.
Is it fair to say that most of the decisions with respect to when they are going to go or that they are going to go to PA school comes when they're an undergrad then?
Probably the majority do. We have a few students who had an experience as a child that led them down this path, some interaction with a medical person that led them down this path. But the majority of them start off college knowing they like science, they like that field. Then they go through, do I want to do physical therapy? Do I want to? And it's sort of an evolution. So, but we have a few that do decide young.
Ginger Ruhnke, when you consider the people who are listening to our program, we've grown up in Kansas or we've come to Manhattan from the service or for public education or for whatever reason, and we know enough about healthcare to understand that it's vitally important. We may or may not get involved with it. What do you want us to know about the way that rural healthcare is being challenged today in small towns?
That I think one of the important things is knowing that we're there. Come sit down, come talk to us. We can help you navigate through preventative health, through chronic health conditions, acute health conditions. We're there to help you live the best quality of your life that we can, and that we're there.
What keeps you up at night when you think about some of the challenges?
I think sometimes it's not even necessarily systemic challenges. It's just me as a provider, being concerned for my patients.
There's a human aspect to this, right?
Yeah.
You have so much bandwidth, right? You got a family, you got a job, right? Amy, let's wrap it up with you. And when you consider the PA program, right, and then consider that people may not even be aware that exists, right? What is it that those of us who live here need to know about the PA program and what it's going to be doing for rural healthcare in Kansas?
So, I think the fact that people are actually pretty aware of PAs, we have some in the local community, and especially if you've lived in rural Kansas, you've probably run across a PA. We're trying to support the system. We're not here to take over the system. We're not trying to be the sole provider in all of western Kansas. We want to be part of a team of other medical providers to provide care to those rural communities.
What's the best thing about rural healthcare? What's the best thing about your job, Ginger?
Getting to connect with people within my own communities. And getting, it's people that I see at the gas station or I see in the grocery store, and I get to help them live their best life.
And then last question, I said it was the last question.
I know.
It was the next to the last question. And so very last question,
Very
Amy,
last.
what's the best thing about the K-State PA program?
K-State has provided us with a fantastic facility and program to help the state of Kansas.
Kansas does not need more waiting rooms. We need more healthcare professionals. That is the heart of the motivation behind Kansas State University and Stormont Vail Health teaming up to turn ambitious students into capable physician assistants who are ready to serve where they're needed most. My gratitude today to Amy Fitzgerald of Kansas State University and Ginger Ruhnke of the Stormont Vail Health Wamego Clinic, not only for offering their time with us here today to share their passion and their experience and their talent and their knowledge, but for offering the second thought, a shared commitment to strengthening the Kansas healthcare workforce and helping to ensure that you and I get the care that we need. Those of us in the Flint Hills region have a deep and abiding respect for the United States Army. Tomorrow we will talk about how it came about, from citizen patriots to a military force that secured 250 years of American independence. Our guest tomorrow will be Manhattan military historian and author Bob Smith. We are within mere seconds of wrapping up our live radio talk show here on News Radio KMAN, but we're also an unedited audio podcast, and you can find us on the KMAN website later today. We will also be on YouTube, on Spotify, on Audible, on Amazon Music, and on Apple. My thanks as well to our partners on Within Reason, Stormont Vail Health, McCown Gordon Construction, and the Trust Company. They saw the premise of fostering critical thinking and agreed with our idea that we need more of it. My name is Mike Matson. Thanks for listening.
KS State Bank offers convenient services to help make life a little easier. Visit ksstate.bank to learn more. KS State Bank, member FDIC, equal housing lender. KMAN, Manhattan.